Welcome back to the deep dive. We're the place where we really tackle those complex topics, digging into the academic sources, the professional literature,
Mhm.
and basically distills it all down so you walk away actually understanding it.
Yeah, getting to the core of it.
Exactly. Today, we're diving into something absolutely fundamental in healthcare,
Mhm.
defining and developing professional competence.
It's a huge topic, really foundational.
It really is. And think about this central question. What is it that actually elevates a job, just any job, into a profession?
Right.
Why do we as a society grant doctors, nurses, pharmacists, why do we give them such, immense trust and autonomy?
That's a good question.
It all seems to boil down to this mix of specialized knowledge, these deep ethical commitments, and a sort of covenant of accountability.
That's a great way to put it, a covenant.
So that's our mission today. We're going to try and clarify the sometimes confusing relationship between a profession, the professional person, the whole process of professionalization, and maybe most importantly, the daily practice of professionalism.
And we're focusing specifically on healthcare, obviously, given its high stakes. We want to provide insights that are actionable for you, the listener, the learner, especially if you're on this journey right now.
And it's so important because this isn't just, academic theory.
No.
Our sources, which come heavily from health professions, education, from ethical frameworks, they make it really clear. The public trust placed in healthcare workers. It's fragile.
Very fragile.
Yeah, and it's completely dependent on this ethical foundation we're talking about. So this deep dive, it's about understanding that you're not just learning clinical skills, you're adopting a whole standard of values and accountability. That's what underpins the trust.
Values and accountability, got it.
We really need to understand the language, the terms, before we can even try to live the principles.
Absolutely. So, okay, over the next 20, maybe 30 minutes, we'll unpack all this source material. We'll give you clear definitions, outline the core principles, detail those day-to-day professional responsibilities.
And look at specific student attitudes. We'll make sure every concept is explained really clearly with good examples, analogies, the works.
Sounds good. Let's do it.
All right, let's jump in. Okay, first things first. Let's unpack this foundational vocabulary because honestly, in everyday talk, we throw around job, career, profession, almost interchangeably, right?
We absolutely do, yeah.
But in the context of healthcare, regulation, ethics, these terms have really distinct meanings. So what truly sets a profession apart from, say, just a typical job?
Yeah, that's the crucial starting point. The difference really hinges on structure and the level of commitment involved.
Yeah.
We start with a basic definition, like from Oxford.
Okay.
A profession is essentially an occupation or career where you apply specialized knowledge of a specific subject, field, or science.
Some specialized knowledge. Okay.
But what elevates it beyond just being a career are what the sources call 3 non-negotiable must-haves. These establish its legitimacy in society.
3 must-haves. All right,
Yeah.
what are they?
Okay, the first one is prolonged training. This isn't just a weekend course.
Right.
It means lengthy, dedicated academic training leading to a formal qualification. And we're talking about, years of university study, navigating really rigorous coursework, passing tough national or specialized exams, and ultimately earning a specific diploma or degree. It's this intense academic journey that sets it apart.
So it's not just what you know, but the whole structured process of how you learned it and the sheer time investment needed to master it.
Exactly. The rigor and the duration matter.
Can you give us maybe an analogy just to make that depth clearer?
Sure, think about it like this. Compare a highly skilled auto mechanic. They definitely have a job, maybe even a career. They know engines inside and out, incredible skill.
Yeah.
But generally, they acquire that expertise more through apprenticeship, hands-on experience, maybe some technical courses. Now compare that to, say, a medical doctor or a dietitian or a clinical pharmacist. Their knowledge base comes from fields like biochemistry, anatomy, pharmacology, pathophysiology. It's structured, it's research-based, and it absolutely has to be absorbed over many years of formal academic study.
Right. The public expects that deep, science-based academic foundation.
Precisely. And that expectation leads directly to the second must-have, specialized knowledge.
Okay.
This knowledge isn't just common sense or something you pick up easily on the job. It's derived directly from academic learning, formal education, scientific research, specific clinical training.
So the public accepts that this person knows things they don't.
Yes, and that acceptance is critical. It's what allows the professional to exercise judgment in really high-stakes, complex situations. diagnosing a rare illness, formulating a complex treatment plan, compounding a potent medication.
Situations where the average person just wouldn't have the background.
Exactly. And if you have that prolonged training and that specialized knowledge, you then need that third piece,
Right.
the structural component to maintain standards.
Makes sense. What is it?
It's the regulatory body. A profession is almost always governed by some kind of professional body. Think licensing boards, medical councils, pharmaceutical associations.
Okay, yeah.
These bodies do several key things. They set the competence exams you have to pass. They act as the licensing authority. They give you the permission to practice. And, crucially, they enforce adherence to a strict ethical code of practice.
Ah, the ethical code.
Yes, this body holds the individual professional accountable to those standards.
Okay, I can see the tension there immediately. That regulatory structure, it ensures standards, which is good, but it also creates significant pressure, right?
Huge pressure.
Because if I breach that code, I don't just risk getting fired from a job, I risk losing my license, my entire professional identity.
Precisely.
Yeah.
That oversight, that's the formal stamp of a profession. Society grants you certain privileges, like the ability to make life-altering decisions. But it's in exchange for this ethical guarantee enforced by the regulatory body.
Okay, so that defines the profession itself. What about the professional? Who are they, according to these sources?
Right. So professionals are defined as a disciplined group of individuals.
Disciplined.
Yes, that word is key. They adhere to those ethical standards set by the regulatory body, and they're accepted by the public as possessing this special knowledge and these unique skills. Discipline is crucial. Are you disciplined in your studies right now?
Mm.
Do you show up on time for classes, for labs? Do you follow the rules of the institution? That discipline in seemingly small things, the sources suggest, translates directly to reliability when the stakes are much higher.
That's a good point. But the core distinction reading the material, it isn't just about competence or discipline, is it? It seems to hinge on the professional's motivation.
That is the absolute defining element, yes. Professionals exercise their skills primarily for the benefit of others.
Ah, okay.
You're not just striving for high marks for your own ego or trying to maximize income above all else. You're doing it because you genuinely want to be an excellent healthcare provider who serves the patient well. The focus immediately shifts outward, away from the self.
Serving the patient.
And because of that perceived commitment, the sources highlight a really fascinating statistic.
Oh, yeah. What's that?
It turns out that healthcare professionals, specifically nurses, medical doctors, pharmacists, consistently rank among the most highly trusted professions globally.
Wow.
Globally.
Yeah, it speaks volumes, doesn't it? The public accepts its inherent imbalance of knowledge and power because they trust that your primary motivation is their welfare, not your own self-interest.
But that trust isn't automatic.
Absolutely not. It has to be earned constantly and maintained through consistently ethical action. Every single day.
Okay, so we've got profession and professional. What about the last term, professionalization? That sounds more like a process, like something that happens over time.
It is exactly that. It's a developmental process, and the sources define it in two important contexts.
Okay.
The first is individual professionalization. This is the journey of taking someone from being, let's say, less professional, maybe year one student, still figuring out time management, discipline, ethical boundaries.
Yeah, we've all been there. Right. And transforming them into a fully formed, established professional over, say, 4 or 5 years of intensive study and clinical experience. The whole educational system is designed to actively professionalize you.
So the university or college is part of that process?
A huge part. And the second context is career professionalization. This looks at it historically. It's the process where an entire occupation moves from not being recognized as a profession.
Like an earlier example.
Yeah, think about pharmacy again. Centuries ago, mixing herbs and folk remedies wasn't really a formal profession.
Right.
But over time, through developing specialized education, grounding it in scientific research, establishing strict ethical codes, and getting governmental regulation, pharmacy earned and solidified its status as a regulated profession.
So occupations can sort of level up to become professionals.
Exactly. And this process is ongoing. It ensures that standards keep evolving as science and society change.
Okay, we've laid the groundwork, the structure, the people, the process. Now, this is where, for me, it gets really interesting. We shift from the external structures to the internal mechanism, the belief system, professionalism. It's clearly not just about, showing up on time or wearing the right clothes. The sources describe it as this broad, deeply held, personal belief system. So What's the overarching concept here? What defines professional behavior?
At its absolute core, the broad concept is actually quite simple to state, but incredibly demanding to live up to.
Okay.
Professionalism fundamentally means putting the other's needs above your own,
Putting others first.
consistently. It reflects your deepest personal values, your beliefs about how you should conduct yourself, especially when you face conflicts, pressures, or difficult choices.
And because it's rooted in internal values.
Exactly. Because it's so internal, there isn't one single, neat, universally agreed upon definition that captures everything. But that central theme, prioritizing the patient's welfare, remains constant across all descriptions.
Okay, but let's be real. That sounds like a potential recipe for burnout, doesn't it?
That's a very real concern.
The job itself is already incredibly demanding, physically, emotionally. How do you balance this constant demand to prioritize the patient with, the need for your own personal sustainability? You can't pour from an empty cup.
You absolutely can't. And that tension is real. It's acknowledged. That's why professionalism isn't about martyrdom or self-sacrifice to the point of collapse.
Okay.
It's more about maturity, balance, and dedication. It means providing excellent care even when it's inconvenient, even when it's demanding. Like staying late to thoroughly document a complex patient case instead of rushing home because you're tired.
So it's about the difficult choices.
It's about making the right choice for the patient in those moments. Now, this internal belief system, it doesn't exist in a vacuum. It's demonstrated, it's made visible through a foundation built on three essential elements.
3 pillars.
Kind of. First, you absolutely must have clinical competence.
Yeah.
You have to know your stuff, period.
Makes sense.
Second, you need excellent communication skills. How you interact matters with respect, clarity, empathy, basic politeness.
Okay.
And third, you need a sound, ethical, and legal understanding. You have to know the rules, the boundaries, the moral obligations of your role.
And if one of those is weak?
If any one of those three pillars, competence, communication, or ethical legal understanding is weak, your ability to demonstrate professionalism is compromised, even if your intentions are good.
Right. Good intentions aren't enough if you don't know what you're doing or can't explain it properly.
Precisely. So to make this more concrete, the sources we looked at often refer to formal definitions from governing bodies, just to kind of align expectations across the field.
Yeah, what did they say?
Well, for instance, the American Board of Internal Medicine, ABIM, defines professionalism as explicitly placing patient interests above the physician's own interests.
Okay, the putting others first again.
Exactly. And also maintaining high standards of competence and integrity, and providing expert advice not just to patients, but to society as a whole.
Interesting, that societal role.
Yeah. And another example, the American College of Clinical Pharmacy, ACCP, they emphasize that professionalism creates this conventional relationship built squarely on trust between the patient and the pharmacist.
Trust again.
Always trust. And they stress this trust isn't just granted because you have a degree. It has to be actively earned over time through consistent, reliable, ethical behavior.
Okay, so let's dive deeper into that internal compass. What are the specific guiding principles? The sources mentioned 4 principles of professionalism.
Yes, these 4 are like the non-negotiable core values that should guide your behavior internally. First is service excellence,
Meaning?
meaning doing your work with the absolute highest possible quality and dedication, consistently aiming for the best possible outcomes for your patients, striving for excellence.
Okay, number 2.
Second is humanism. This is about demonstrating genuine care, compassion, empathy.
Seeing the person, not just the disease.
Exactly. The humanistic professional sees the patient as a whole individual, someone with a family, a job, worries, fears. Not just a case number or a collection of symptoms in a file. It's about preserving their dignity.
Crucial theory.
The third principle is accountability. This means being fully responsible for your actions, your decisions, your words, taking ownership of the outcomes, whether they're good or bad.
So, no blaming others.
No blaming others.
Yeah.
It includes self-monitoring, being willing to admit when you made a mistake, and learning from it.
Okay. And the 4th one, you mentioned it was ethically challenging.
Yes, the fourth, and perhaps the cornerstone, is altruism.
Altruism. Define that in this context.
As we touched on earlier, it's explicitly defined as choosing someone else's needs over your own, putting the dedication to serving the best interest of the patient before your own convenience, your personal preferences, sometimes even financial gain.
That's a high bar.
It is. It's really the ultimate ethical test for a healthcare professional. Can you consistently prioritize the patient's needs?
And that deep commitment, it means professionalism isn't something you can just switch on and off, right? The sources were clear. It needs to be consistent across different relationships.
That's a really important nuance. You're right. Professionalism isn't just a performance you put on for patients.
No.
No, it has to be demonstrated consistently with three distinct groups. First, obviously, the patients. Second, critically, your peers,
Yeah.
your colleagues, fellow students in the same field.
Okay.
And third, other healthcare professionals. The doctors, nurses, technicians, dietitians, pharmacists you work alongside. Effective collaboration is key.
So if you're rude or disrespectful to your colleagues,
You're undermining the very team structure that's necessary to provide safe and comprehensive patient care. It's unprofessional, full stop. It affects everyone.
okay, we've covered the broad values, service excellence, humanism, accountability, altruism. Now, the discussion seems to shift, based on the sources, to three really specific fundamental principles. These sound like the absolute non-negotiables, the pillars of that patient covenant you mentioned.
That's exactly right. These three are centered squarely on the patient relationship. They are the bedrock.
All right, what's the first one?
The first pillar is fundamental, maybe the most obvious one, patient welfare.
Okay.
This is the absolute core commitment to serving the patient's best interest above all else. It means you have to prioritize their health, their safety, their well-being over any other considerations, whether those are financial pressures, institutional rules, or even your own personal convenience.
So it's the practical application of altruism in the clinic.
Precisely. It's altruism in action focused on the patient in front of you.
Got it. What's the second fundamental principle? You hinted it can be difficult.
Yes, the second one is often the most challenging to implement correctly, especially when things get stressful or complicated. Patient autonomy.
Autonomy. Self-rule. What does that really mean in practice, beyond just, getting a signature on a consent form?
That's the key question. Patient autonomy is the patient's fundamental right to self-govern, to make their own informed decisions about their own body and their own medical treatment.
Okay.
The difficulty lies in making that informed decision possible. True autonomy requires genuine empowerment.
Empowerment. How?
It means professionals have an obligation to be completely honest. You have to provide all the necessary information, risks, benefits, alternatives, uncertainties, and do it in a way the patient can actually understand, not medical jargon.
Right.
And then, the most critical part, you have to empower the patient to make the final decision about their care.
Even if you disagree with their choice.
Even if you, as the expert, believe a different path might be medically better. Think back to that video anecdote mentioned in the sources.
Oh, yeah, the language barrier one.
Exactly. The patient insisted on being spoken to in his own language so he could truly understand his situation and decide for himself, rather than just having the doctor impose a treatment plan.
He wanted agency.
He wanted agency. The professional must respect that the patient is a human being with the ultimate right to determine their own life path. Your role is to provide expert advice, guidance, support, but you are not dictating orders.
Wow, that's a massive shift from the old sort of paternalistic, doctor knows best model, isn't it?
Huge shift. It demands a partnership. And it means the professional has to learn how to manage that potential conflict, the tension between what clinical evidence suggests is best and what the autonomous patient actually chooses.
That takes real communication skill. And respect.
Immense skill and respect. As long as the patient is mentally competent to make the decision, their choice is paramount.
Okay. Patient welfare, patient autonomy. What's the third fundamental principle?
The third principle broadens the focus. It's social justice.
Social justice. How does that fit into individual patient care?
This is where the professional's commitment extends beyond the one-on-one interaction to the wider healthcare system and society. Social justice in this context means actively working to ensure fairness within the system.
Fairness in what way?
Specifically, focusing on the fair and equitable distribution of healthcare resources and, critically, access to care.
So professionals have a duty to be advocates for a fairer system.
According to these principles, yes. It implies responsibilities like actively promoting public health initiatives, emphasizing preventive medicine, because that benefits everyone,
Right.
and consciously working to identify and reduce systemic barriers that prevent people from getting equitable care.
Barriers like.
Language barriers, financial barriers, geographic barriers, cultural misunderstandings. The sources paint a pretty stark picture here. We might be training or working in well-resourced settings, but we have to remember
Yeah.
that even in some of the wealthiest countries on Earth, There are people, the sources mention examples like elderly people living on the street without insurance who lack access to basic, sometimes life-sustaining care.
That's sobering.
It is. And the principle of social justice says a professional cannot just turn a blind eye to that kind of structural inequality. You have a responsibility to advocate for system changes to work towards ensuring access is more universal, truly fair, and based on clinical need, not just on someone's ability to pay or their social status.
Okay, so we've established the core values, altruism, humanism, and the fundamental principles, welfare, autonomy, social justice. Now let's get practical. The discussion moves to the specific actions, the commitments professionals make every day. The sources listed quite a few.
Yes, there are 8 key responsibilities outlined. These are the concrete ways those values and principles show up in daily practice.
And it feels important for, you listening, the learner, to see these as the actions that stem from the underlying values we just talked about.
Absolutely. They're the how-to of professionalism. This list is pretty comprehensive because it really defines the practical demands of upholding that patient covenant.
All right, let's go through them. What's the first one?
First is the commitment to professional competence.
Competence. Knowing your stuff.
Exactly. But it's more than just knowing it once. This requires continuous professional development, CPD, and an unwavering commitment to lifelong learning.
Lifelong learning, that comes up a lot.
It has to. We have to emphasize this. Getting your diploma, your degree, that's the starting line, not the finish line.
Right.
If you stop learning in healthcare, where knowledge changes so rapidly, new drugs, new techniques, new understanding of diseases, you risk becoming incompetent.
And incompetence in this field isn't just embarrassing.
It's dangerous. It has dire consequences. The analogy is clear. Medical knowledge has a half-life. It expires. If you stop actively seeking out new evidence, new guidelines, you risk misdiagnosing conditions, prescribing treatments that are outdated, ineffective, or even harmful.
So how do you uphold this commitment practically?
Through various mechanisms. Rigorous self-assessment is key. Am I really competent to perform this new procedure? Do I understand the latest guidelines for this condition?
Honest self-reflection?
Yes. Also, actively attending development courses, conferences, workshops, seeking further education, whether it's a formal degree or just staying current through professional journals and training. It's a perpetual, ongoing commitment.
Okay, competence is number one. What's next?
Next is the commitment to honesty with patients. This links directly back to that principle of patient autonomy and informed consent we discussed.
Honesty. Seems straightforward, but...
It's straightforward until it's difficult. Critically, this includes the very painful but necessary acknowledgement of medical errors.
Owning mistakes. That's tough.
It's incredibly tough. But errors must be acknowledged. They need to be reported transparently, first and foremost to the patient who is affected.
Wow. Directly to the patient.
Yes. And then analyzed internally within the healthcare team or institution. Look, we're human. Mistakes will happen.
Yeah.
But the primary purpose of reporting and analyzing isn't just to assign blame to an individual, it's to understand why the error occurred and to correct the systemic issue.
Fix the process, not just punish the person.
Exactly. The process, the workflow, the protocol, whatever allowed the error to happen needs improvement to prevent future harm to other patients. Hiding a mistake is a profound ethical failure because it allows a potentially broken system to continue hurting people.
That makes sense. Honesty also applies to just delivering bad news, right?
Absolutely. Communicating difficult diagnoses, explaining a poor prognosis clearly and compassionately, ensuring the patient truly understands their situation, even when the news is severe. That's part of honesty, too.
Okay. Honesty. Next.
Moving on to commitment to patient confidentiality, protecting patient information.
This one feels like a big one, especially now with digital records and social media. Seems obvious, but where do people, especially students or new professionals, tend to slip up unintentionally?
That's a great question. Confidentiality involves safeguarding all patient information, and it's often formalized by laws like IPAF in the U.S., but the principle is universal.
Right.
Unintended breaches often happen through casual carelessness, like discussing a patient's case in detail in a public elevator or cafeteria where others can overhear.
Yeah.
Or maybe venting about a difficult patient to a friend or family member outside the hospital. Even without using names, sometimes enough detail is disclosed, and the digital space is a minefield. Taking an unauthorized photo of a patient, even if you think it's harmless, like a cute baby in the neonatal ICU, and sharing it, that's a massive breach.
Even with good intentions.
Even with good intentions. Taking and sharing that image violates the sacred trust of privacy. The fundamental rule is, Whatever happens within the confidential context of care, whatever you learn about a patient, must remain confidential. Period.
Okay, protecting patient secrets leads us right into the next, often tricky area: commitment to maintaining appropriate relations. The sources really hammer this point. Patients are not your friends, not potential romantic partners.
Yes, this boundary issue is absolutely critical. Why? Because the professional-patient relationship is inherently unequal.
Unequal how?
There's an imbalance of power, of knowledge. The patient is often in a vulnerable state. Because of this imbalance, certain types of relationships must be strictly avoided to prevent the possibility of exploitation, even unintentional exploitation.
Exploitation. Strong word.
It is. And the source material makes a very important distinction here between what they call a boundary crossing and a boundary violation. It's not always black and white.
Okay, this sounds important. Let's spend a moment here. How do we tell the difference between a boundary crossing and a full-blown boundary violation?
Good question. A boundary crossing is usually described as a brief or maybe limited excursion across the typical professional line. Think of it like momentarily stepping over the line but not setting up camp there.
Okay.
Sometimes these crossings can even be purposeful, maybe intended to meet a specific therapeutic need for the patient. But even then, they need careful evaluation and shouldn't become a pattern.
Can you give the example from the source?
Yeah, the example was Jack, a physical therapist. His patient, Lucy, is really discouraged about her progress. Jack knows she's a huge basketball fan, so he gives her a team sweatshirt. That's likely a boundary crossing. It was intentional. His motive was arguably therapeutic, trying to boost her morale. But it definitely introduces a personal element into the professional relationship. It needs to be acknowledged, maybe discussed with a supervisor, and carefully monitored. Did it help? Did it create awkwardness?
Right, so it's not automatically bad, but needs watching. What makes it tip over into a violation?
A boundary violation is much more serious, often harmful, and usually harder to undo. A violation happens when there's a clear confusion between the needs of the professional and the needs of the patient.
The professional's needs start creeping in.
Exactly. Violations often involve things like secrecy, the professional disclosing excessive personal information about their own problems, or even a role reversal where the patient starts taking care of the professional's emotional needs. Crucially, the professional starts putting their own gain or needs, emotional, financial, social, ahead of the patient's welfare.
Okay, can you use those examples again to show the slippery slip from crossing to violation?
Sure. So Jack gives Lucy the sweatshirt openly, maybe mentions it in the chart notes as a motivational attempt. That's the crossing.
Okay.
Now, imagine Jack gives Lucy the sweatshirt secretively, tells her, don't tell anyone, and then suggests maybe they should go to a basketball game together sometime.
Whoa, okay, that's different.
Totally different. That immediately becomes a violation. Why? There's secrecy involved. That's a huge red flag. And his suggestion clearly shifts the relationship from therapeutic towards personal or potentially romantic. His needs are now involved.
Got it. Other example, the financial one.
Right, the financial extreme.
Yeah.
The sources give a clear violation example. Mary, a healthcare professional, is having financial troubles. She discloses these personal problems to her patient, Dorothy. Dorothy, feeling sympathetic, offers Mary a substantial loan, and Mary accepts it.
Yikes.
Big yikes. Mary clearly placed her personal financial gain ahead of Dorothy's best interests. She exploited Dorothy's vulnerability and goodwill, which stems from the professional relationship. That's a major violation.
In the most extreme form.
Any kind of professional sexual misconduct is the most extreme, catastrophic form of boundary violation. It's a fundamental abuse of power and trust. The guiding rule has to be crystal clear. Always, always act in the patient's best interest. Never confuse their needs with your own.
That distinction between crossing and violation and the red flag of secrecy is incredibly helpful. Okay, let's move to the final few responsibilities. These seem broader, more organizational.
Yes, the last 4 commitments focus more on systemic action and the professional's role within the larger healthcare environment. First is the commitment to improving quality of care.
Quality improvement, like audits and stuff.
It includes things like audits, yes, but it's broader. It's about a mindset of continuous quality improvement, CQI, and active collaboration within the entire healthcare team. Professionals are expected to be agents of positive change, not just passive participants.
So always thinking, how can we do this better?
Exactly. How can we make this patient journey safer, this process more efficient, this outcome more reliable? Constantly seeking improvements.
Okay.
Second is the commitment to improving access to care. This ties back to social justice. It means actively working to reduce those barriers we talked about that prevent people from getting the care they need.
Like advocating for translation services.
Perfect example. Or helping patients navigate complicated insurance forms, or supporting initiatives that bring healthcare to underserved areas. It's about actively trying to make access more equitable.
Makes sense. Third.
Third, and also closely linked to social justice and quality, is the commitment to a just distribution of finite resources.
Finite resources.
Yeah.
Meaning money, supplies.
Exactly. Medication budgets, staff time, hospital beds, even basic supplies like gloves or printing paper. These resources are always limited, even in apparently wealthy countries or well-funded hospitals. There's never an infinite supply.
Okay.
So this commitment requires stewardship. Stewardship means the wise, responsible, and cost-effective management of these limited clinical resources.
I think a lot of students or learners might think, well, I work in a big hospital, they have plenty of money, it doesn't matter if I use extra supplies. Why is stewardship still so crucial even then?
Because every resource, even seemingly small ones, has an opportunity cost. Every dollar spent unnecessarily on an overly expensive drug when a cheaper, equally effective generic exists.
Yeah.
Or every excessive box of gloves wasted, or reams of paper printed needlessly. That's resources, money, materials, time that could have been used for another patient, another essential service, maybe a public health program.
So it's about the bigger picture of allocation.
It's about collective responsibility. Poor stewardship might look like routinely ordering the most expensive brand name medication without considering generics, or being wasteful with supplies because the hospital pays for it. You have a professional duty to practice resourcefulness and cost effectiveness, even when, quote, no one is watching your supply cabinet usage. It's an ethical obligation.
That's a really practical point. Okay, and the final commitment.
Finally, number 8 is the commitment to scientific knowledge. This means rigorously grounding your practice in the best available scientific evidence, ensuring clinical decisions are informed by research, data, and established science, not just by anecdote, tradition, or personal convenience, staying current with the evidence base.
All right, we've covered the definition, the values, the principles, and those 8 key responsibilities. Now let's shift the focus squarely onto the listener, the learner. How do all these high standards, these complex values, principles, actions, how do they actually translate into student attitudes and behaviors right now? And maybe more importantly, how is this quality of professionalism developed in real time during training?
This is absolutely crucial because the sources are very clear. The attitudes and behaviors you exhibit as a student are direct precursors, direct predictors of how you will behave as a practicing professional.
So habits formed now stick.
They really do. The sources outline specific tenets or core values of professional attitudes that students need to focus on cultivating from day one.
Okay, what are they?
The first mirrors the core value, fostering altruism, even as a busy student.
How can a student show altruism?
Through action. Maybe volunteering some time for health-related causes in the community, participating in student-run clinics or health fairs, even just managing your studies efficiently so you still have the mental energy and time to genuinely care about societal well-being, not just your own grades.
Right, looking beyond the textbooks, what's second?
Second is honesty and integrity. And here, the source material poses a very direct, very pointed question.
Which is?
It basically asks, do you cheat on exams?
Wow.
Straightforward.
Very.
Very, because the logic is powerful. If you cheat on an academic exam, now say an exam testing your ability to calculate medication dosages accurately,
Yeah.
you are demonstrating a value. The value is dishonesty, a lack of accountability, and a willingness to take shortcuts that could, down the line, endanger a patient, all for your own immediate convenience or gain passing the exam.
So cheating now signals a potential risk to patients later.
Exactly. That underlying value, that willingness to be dishonest when pressured, if it's not identified and corrected now, the sources argue it will follow you into your professional practice. It's a fundamental character issue.
That's a really powerful connection. Exam integrity as a direct proxy for future patient safety integrity.
It's seen as the ultimate litmus test of your foundational integrity. Can you be trusted when the stakes are low? Because if not, how can you be trusted when the stakes are life and death?
Makes sense. What's the third attitude?
Third is respect for others and diversity. This goes beyond just patients. It means treating everyone you interact with in the academic and clinical environment with equal respect.
Everyone meaning?
Your classmates, your professors, yes, but also the cleaning staff, the administrative assistants, the lab technicians, everyone. The source even suggests a simple daily training exercise. Make eye contact, say good morning, or just acknowledge everyone you pass in the hallway, not just your friends or perceived important people.
Why is that important practice?
It trains your mind. Train yourself to remember your peers' names now, because that builds the habit you'll need to remember your patients' names later. It reinforces the idea that everyone, regardless of their role, background, or status, has inherent dignity and deserves respect.
Okay. Respect for all. Fourth.
The fourth attitude is professional presence. This isn't just about being physically in the room, in class, or on rounds.
What else then?
It's about being mentally engaged, being present, participating actively, asking thoughtful questions, raising your hand, wanting your voice and perspective to be heard in discussions, being a reliable, contributing member of your study groups or practical teams, showing up ready to learn and engage.
So active participation, not passive presence.
Precisely. And the fifth attitude is professional stewardship. This connects to leadership potential.
Stewardship as a student, how?
It means demonstrating leadership qualities even now. Taking initiative in group projects, assuming responsibility, maybe participating constructively in student societies or committees, taking ownership of your learning environment. This prepares you for future roles leading and managing healthcare teams or resources.
Okay. Altruism, honesty, respect, presence, stewardship. It sounds like this all really boils down to accountability in everyday student life, doesn't it?
It absolutely does.
Yeah.
Accountability in daily life is the training ground. The source gives a simple, relatable example.
Yeah.
If you're late for class, are you honest about the reason? Do you say, sorry, I overslept, or I spilled coffee all over myself and had to change? Or do you make up an excuse?
Blaming the traffic, the bus.
Exactly. Blaming non-existent traffic or some mythical bus breakdown avoids accountability. Owning your action, even a small one like being late, builds that muscle of integrity. That bedrock of small-scale accountability is absolutely necessary before you can handle the immense weight of high-stakes patient accountability later on.
Okay, so these are the standards, the attitudes students need to cultivate. Now let's tackle that big philosophical question that came up in the sources. Can professionalism actually be taught? Or is it just something you either have or you don't like, an innate quality?
Yeah, that's the million-dollar question, isn't it? The consensus from our sources and generally in health education is that it's actually both.
Both. How?
Well, it is sometimes partly born, so to speak, meaning some individuals, maybe through a strong upbringing or early life experiences, might come into training already possessing strong intrinsic values like honesty, empathy, respect. They have a good starting point,
Okay, so some have a head start.
perhaps.
Huh.
But, and this is the crucial part for everyone, even those with strong intrinsic values, professionalism isn't automatic. It can, and it absolutely must, be consciously developed, nurtured, and refined through a rigorous, intentional, lifelong journey.
So you don't just absorb it by being around doctors or nurses?
No, definitely not just by osmosis. It requires active, intentional effort and specific developmental activities.
Okay, so what are those actionable, measurable ways to develop it? What did the sources emphasize for learners?
The primary methods mentioned include, first, simply gaining experience and practical wisdom. Learning through doing, through encountering real ethical dilemmas in clinical settings.
Learning from experience. Okay.
Second, seeking out effective mentoring. Finding experienced ethical professionals who can guide you, offer advice, and share their own journeys and challenges.
Having a mentor, that's key.
Hugely important. Third, consciously identifying a positive role model. Finding a practitioner whose behavior, whose communication style, whose ethical commitment you deeply admire and want to emulate, watching how they handle difficult situations.
Learning by example.
Exactly. But the single most important developmental mechanism, emphasized repeatedly, is continuous self-evaluation through structured reflection and discussion.
Reflection. What does that mean practically? Not just staring out the window.
No, not just vague thinking. It means structured, honest, often daily self-critique.
Yeah.
Actively asking yourself, was I professional today in my interactions? Did I uphold those principles? Did I speak disrespectfully to anyone, a patient, a peer, a staff member? Did I cut a corner? Did I tell even a small lie about my preparedness or actions?
So a daily personal audit.
A daily audit. And crucially, it's not just reflecting internally. It's discussing these reflections, these challenges, these uncertainties with trusted advisors, mentors, preceptors, getting feedback, talking through the gray areas.
So reflection plus dialogue.
Yes, that continuous cycle act, reflect, discuss, refine act. Again, that's the engine that drives genuine professional development. It ensures that the promise you make when you choose this path, the promise of professionalism, is something you are actively working to fulfill every single day of your career. It's a lifelong process.
Yeah.
Hashtag outro.
Wow. This has been an incredibly detailed and I think really necessary look at the absolute foundations of healthcare ethics and competence, just to try and summarize the major clarification we aimed for.
Hmm.
Professionalism isn't just one thing. It's this complex, sophisticated intersection of highly specialized knowledge, a really rigorous ethical commitment, and that active daily prioritization of the welfare, the autonomy, and the social justice for the people you serve.
Yeah.
It's fundamentally a structure built entirely on accountability and ultimately on that fragile thing we keep coming back to, the trust granted by the public.
Well said. And if we link that back to the bigger picture, the sort of central challenge that echoes through all our source material is this. Professionalism isn't like a certificate you get handed one night at graduation.
Right. It's not a destination.
It's an attitude. It's a set of values you have to consciously promise to start developing from day one of your training, and then recommit to upholding every single day after that for your entire career. It's an ongoing choice, not some inherent state you achieve.
An ongoing choice. I like that. Okay, so we've covered competence, honesty, accountability, all these huge concepts. So let's leave our listeners with this final provocative thought, building on that need for reflection you just highlighted.
Okay.
How will you, the listener, the learner, how will you actively engage in that process of reflection and discussion just this week? Pick one area of professional responsibility we discussed. Maybe it's reflecting on a boundary crossing you witnessed or were part of. Maybe it's thinking about how you could improve your stewardship of resources in your current setting. How will you take one concrete step to make your own professional journey one of truly intentional, continuous learning?